Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to two Johns Hopkins professors, Elizabeth Stewart and Carrie Althoff, about how COVID-19 will impact Halloween, Thanksgiving, and life inside as the weather cools off. They discuss coming up with ways to make this year's celebrations special, despite the pandemic, and how to plan for the unexpected. Let's listen.
Carrie Althoff and Elizabeth Stewart, thank you so much for joining me.
Thanks for having us.
Thanks for having us.
So, Carrie, I'm going to start with you. The listeners can't see this, but I can see the skeleton taped up to the window in your office there. So let's start with Halloween. It's coming up soon. I know you've got little kids. What should parents, families be thinking about, even folks without kids, when it comes to Halloween? I'm not sure door-to-door trick-or-treating is the answer.
Absolutely. There are a lot of questions about Halloween this year. And I think we have to remember to keep things hyper-local. And we also have to remember to keep things really fun, because it is the start of the holiday season where we have Halloween, we'll go into Thanksgiving, and things will be different this year. There's no doubt about it. But we have all been under a lot of stress. We all need this time with our families to recharge, reconnect, really build those relationships back up. We may not be doing it face-to-face. We may have to find other ways, but we need to take this time and we need to enjoy these things that are coming our way this fall and into the winter months. So door-to-door trick-or-treating totally depends on your neighborhood. Do you get a swarm of people where you really feel like it's not going to be possible to keep some distance around your family and others? Are you concerned that a bunch of kids will come up to your door too fast and you don't want that kind of contact? Everyone has to think through their own risk level and set their boundaries, do it before the big night, and then have a plan for the big night that you can enjoy something fun with your family. Do something that you will enjoy.
So Halloween isn't canceled. It's just going to be different.
That's right. Definitely do not cancel Halloween. My children would be very, very upset, as would I.
Liz, I'm sure that you're having sort of the same conversations with your family. Is there, and as Carrie said, Thanksgiving comes right on the heels of Halloween, and Thanksgiving is, famous for having people traveling from all over to see each other. It's one of the busiest travel days of the year is the day before. That's going to bring a lot of concerns, I imagine.
Yes. And I think just as Carrie was saying for Halloween, same idea with Thanksgiving. We need to figure out how to enjoy the holiday, but how to do so safely. And that's going to look different for different people. I think in general, I, for example, would be nervous about traveling. And however, some people might have situations where they can drive to a family member and ideally quarantine ahead of time and say, you know what, we all want to commit to being together for a few days. But in order to have that time together, we're willing to sort of take some time beforehand and afterwards to make sure that we're not sort of exposing ourselves and the people we come into contact with to unnecessary risks. On a personal note, my mom might drive down to be with us for Thanksgiving, but she's committed to keeping herself really hyper-local, full of quarantine for a week or so before she comes, so that we can know that she can then sort of come and join our bubble down here and we can spend that time together.
And I know stereotypically Thanksgiving is a time of all kinds of sort of family disagreements. And it makes me think about sort of how people are approaching wearing masks and social distancing in different ways. I mean, I guess we have to have really serious conversations, right? We have to say, you can't come if you're not going to abide by XYZ, whatever XYZ is that will make you feel comfortable, right?
I think so. But I think the other thing we have to do is lead that conversation with grace, right? And extend to other people the empathy that we all need right now. Like, this has been hard. We miss our family. We miss our friends. We miss each other. We want to have these events and be close to one another. But maybe if it's just seeming too risky Or if people are not going to abide by some of your quarantine guidelines for having them into your home, then maybe instead we need to share a single recipe. Maybe it's a family recipe and say, everybody make this for your Thanksgiving holiday. We're going to Zoom our tables together at this time and enjoy this dish together. Everything else, you can have whatever. And let's see how that brings us together. Let's try and figure out without hurting each other how to be together, because people do really need that connection and want that connection. So quarantining before you go, thinking about ways to connect, even if you can't do it in person. And if you do connect in person, also thinking about quarantining on the back end of things. Because remember, if you do travel to a state with higher levels of transmission, you may be asked by your home state to quarantine when you get back. So all of those things really have to go into it. The name of the game all along when this pandemic has been plan, plan, plan. Get your plan together, use your decision-making frameworks before the event so you know what you're comfortable with, and put in place the plan that you're going to enjoy on the holiday.
Do you think that there will be some schools that are in session? I know some private schools are in session. Do you anticipate that they're going to quarantine kids who travel for the holidays?
I think there will be an ask by many groups, whether it's your child's school, your workplace, if you're going back at all face-to-face right now, especially if you're traveling to a state that has higher levels of transmission. And each state is making different decisions on that. So it's really important to plan ahead and look at what your state guidelines are for quarantine upon return to a home state.
Liz, we've talked about sort of making sure that you plan ahead and having these conversations with people and also limiting the number of people that we see. I mean, that's something I know that you've been doing in your life. Talk to me about what happens when people that you have to have in your life aren't necessarily following the rules. I'm thinking about a friend of mine whose ex-husband, who has part-time custody, takes the kids places they shouldn't, like eating in indoor restaurants, and he goes out to bars in the evening. How can we keep ourselves sane when we have people in our lives like that?
That's such a great question. And you're right. In some contexts, we can sort of make choices about who we interact with and keeping that circle small. In other cases, there are people in our lives for all sorts of reasons that we maybe kind of want them in our lives, but can't sort of fully control their behavior. I think it does go back to the conversations. And I think being really open and transparent about what people are doing, because then it does allow people to, Carrie referenced the decision-making framework, allows people to sort of think back to their own framework and really be conscious about, is this consistent with my own values and my sort of own, the way I'm sort of operating in this current situation? And if it really pushes beyond the limits that someone's comfortable with, I think that's when it's time to really think carefully about other parameters that can be put on that, and a conversation that might have to happen and say, look, please, when the kids are with you, can you only go to, outdoor places? Also reinforce with the kids to wear masks. Sort of try to figure out, are there some guardrails that can be put around this sort of situation? But again, the first part is that communication part, and sort of really being open and clear about what people are doing.
So I've thrown the word pod around a bit, and I know that you have created a small group of people that you interact with. Please tell me a little bit about how that works.
Yeah, so we are very lucky to have a couple other families with children. I have 2 children, and we have a couple other families that have kids the exact same ages. And so all 7 kids are actually very good friends. So we've been able to sort of form our family pod, allowing the kids to go back and forth between houses. So far, not doing schoolwork together, but playing. We do still try to have them outdoors as much as possible. We still encourage outdoor play as much as possible, but especially as the weather gets colder, we anticipate sort of the kids being able to go in and out and interact with each other inside. This, though, too, back to the communication point, it requires close communication and real collaboration with people. So we've set out some sort of expectations around sort of what this means. And one trade-off is that being a part of this, by broadening our circle in this way, it means restricting our circle in other ways. And so, for example, fewer really discouraging the adults from doing anything indoors, encouraging grocery delivery instead of walking around a grocery store, really discouraging indoor restaurants. I mean, these are things that we all are sort of aiming to do anyway. But I think when you have some sort of pod, and whether it's a social pod or a work pod where you're interacting with work people, I think it's just really important to think about the implications. It's not the implications of just on you, but now on all the people that you interact with, and sort of taking on that responsibility and saying, yes, I want to keep this pod safe. And so I now might moderate my behavior in a way to make sure that I really can keep them safe in addition to keeping myself safe. But again, just sort of really taking on that responsibility and in a trade-off of then having this broader social network.
Carrie, I don't know about you, but I cannot get over how long it has been since we have been quarantining, isolating, whatever we call it. Where I've been working at home since March. So I'm not interacting with a lot of people outside my family and a few neighbors. How much longer can we do this? And you have the upbeat attitude. So tell me how we're going to get through the winter.
I think the thing we have to remember this winter is that, it might feel long. We are in a marathon here. We are not in a sprint. And I hate to set expectations that, by the spring, it'll look like this, or no. Let's just take this all 1 month at a time. I will tell you some things I am really looking forward to this holiday season. I find the season to get so busy so quickly, and we're running around. And although I love a good holiday party and all of that, I'm also looking forward to the idea of perhaps, now this might seem a little bit out there, but I attempt to make gingerbread and then make houses from it. I mean, there's like a laundry list of things that I think about, wouldn't it be fun if we did this every holiday season? And we never get to it. So I am trying to think of new and fun things to do, particularly with my kids, because I will tell you, my 9-year-old the other day burst into tears saying how sad he was that Christmas isn't going to happen this year. And I was like, where did that come from? I think as a lot of parents experience, these kids build up this tension and it just erupts sometimes, or at least it does in my house. And, I made a deal with him. I said, buddy, we're going to figure out new things to do this year. We're going to figure out something different. One thing that we're going to try is there's a stable out here, way out here, who will make a private booking with you to try horseback riding. I have no idea if my kids are going to like that, or if they're just going to complain the whole time because they're out there and it'll be cold. I don't know. But something different, right? Something a little bit different to make this holiday season feel its own magic, feel its own sense of uniqueness. Because I will say, in the end, we will look back on this holiday time and we will have these stories to tell about, remember the Thanksgiving of the pandemic, or remember the New Year's of the pandemic. So do something to make that memory.
Liz, she brought up a really good point, by the way, buried in there, which was people might still try to have parties. Can we just say no? I think we have to say no, right?
Yeah, well, yes. With so many things, it depends, in a small party outdoors where people can sort of see each other, but in a controlled way. We are socializing. We got a fire pit. We have one other family over outside the pod. So I think there are ways, but again, as Carrie was saying, thinking about it in different ways. So instead of a party with 100 people inside crammed into someone's house, a series of a couple very small gatherings outdoors around a fire pit, make s'mores. One thing I also really liked in Carrie's comment was her point, like, think 1 month at a time. I think for our own sort of getting through however long we have, I like that framing. I mean, plan ahead to some extent, but it's so hard to know what things are going to look like 2-3 months from now. So try to think what will be fun, what will be feasible in the next month, and then we'll take it from there, and we'll build our muscles in terms of being agile and flexible and creative about figuring out ways to have fun and interact with others.
I will say the one plan that we all need to have in place that will be something we might have to reach for, and we want it at our fingertips, is what do we do if we are needing to true quarantine, where we have an exposure, a known exposure in the household? How do we do that? where the groceries going to come from, who do we call? Because I just had another friend go on quarantine after a known exposure. And you know what? She was panicked. And I said, listen, we went through this in the summer, and the first few days for us were the hardest because it's making those adjustments because it's unexpected, right? All of a sudden you're like, oh, everything comes to a halt for 14 days. You can't leave your house. Things take a different pace. And after you get through the first few days of rescheduling and reshuffling and refiguring, it's okay. Like it's going to be okay. And you'll get through the 14 days, but it helps to have that plan to reach for. The same is true for isolation. In case someone does get sick in your home, where are they going to stay? Who is going to be the primary caretaker? Going to the CDC website and looking through the calendars they have about how many days after that person gets off isolation does the caretaker need to quarantine in order to be sure that the virus isn't continuing to spread. So those types of plans are really, really important to have. And then everything else can just go month by month because you know when you need to hit the pause button because you got to pull out your quarantine plan. That's what's happening for your family. Or you got to hit the pause button because you got to pull the isolation plan. Having those plans in place can make the holiday season still feel like we're going to have fun and do a lot of good things, but we're ready. We've built our resilience and we're ready in case we need to change plans.
Carrie and Liz, thank you so much for joining me.
Thank you.
Thank you.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.